So we're ready to go.
I would like to call the Chapter 566 Durham monthly meeting to order. And let us begin with a moment of silence. Amen. And would you join me in the pledge to the flag?
I pledge allegiance
To the flag
of the United States of America
and to the republic for which it stands, indivisible, under God, with liberty and justice for all. Thank you. I would like to welcome everyone. It looks as though we have about 19 people on the call right now, maybe 20, because I have one behind me who hasn't logged in. My spouse Frank is behind me. So we have 20 people, I believe. Is Mr. Capps here?
He is.
Mr. Capps,
yes, ma'am.
Welcome.
We're
happy to have you today. For those of you who don't know, Mr. Capps is the Business Development Director for Brookdale Nursing Centers in Durham and Chapel Hill. And he's interested in finding out more about what we do and how we operate. And so I'm going to give him 3 or 4 minutes to make a few remarks if he's ready.
Yes, ma'am. Thank you, Ms. London. First of all, I wanted to, can everybody hear me okay?
Yes.
Yes.
Okay. Well, first of all, I just want to thank Tom and Ms. London for having me on today. Like Ms. London said, my name is Davis Capps. I'm the Business Development Director for Brookdale Senior Living here in the Triangle area. And I'm just finding out a little bit about NARFE. For those of you that aren't familiar with Brookdale, we're the largest senior living provider in the country. And I'm the local rep for the NARFE program here in Durham and Chapel Hill. So I'm very interested in learning more about what y'all do so that Brookdale can figure out how we can be a good partner and sponsor programs that y'all might have or be a good resource to any of your members. Just wanted to make the connection today to try to learn more about your program. We're, like I said, we're a national sponsor of NARFE. We have 8 local independent assisted living and memory care communities in the Triangle. So we're spread out all over. Our corporate team in Nashville, Tennessee has put together a nice discounted program for NARFE, 7.5% discount off our base rates for anybody looking for senior living services. But just wanted to make the introduction today. I'm here locally. My main office is at Brookdale, Durham, which is by Duke Regional Hospital. I live in Youngsville, so I'm here locally anytime y'all need anything. But don't want to take too much of your time today, but I did want to make the connection, let you know that I'm here locally. I want to be a partner with NARFE. I look forward to joining some of your meetings in person once we can get this virus behind us, get to know some of you. And I'm just here to help y'all with any senior living resources that you need or anything I can help with. So I appreciate you having me today. And that's about all I wanted to hit y'all with today. Thank you.
Thank you very much. And we look forward to further conversations with you. And I will be in touch with you about sometimes. And we do thank you very much for sharing with us today.
Yes, ma'am.
And I was wondering if anybody had any quick questions for Davis Capps.
This is Henry Bratley. I'm the president of the North Carolina Federation, and I look forward to, along with Carolyn, talking to you more about how we might work together. I'm a licensed nursing home administrator myself from a past life.
Okay, well, bless you. We appreciate it, and thanks Henry for those kind words. And yeah, just a phone call away. So look forward to getting to know you all better.
Thank you so much for taking the time to join us today. We're very happy to make this connection.
Yes, ma'am.
Now, Henry, did you have any other remarks you wanted to make at this time, or do you want to wait till after the program? Or, as Henry said, he's the president of the North Carolina Federation. He's a great supporter of our chapter and, of course, all the chapters here in North Carolina. And we're very happy that you could come, Henry.
And actually now would be a good time, Henry, to make your comments, because we're not going to start the program for another 4 or 5 minutes. Now actually would be a good time.
Well, I was going to yield my time back to the chair, but as you all who know me know, I can talk forever. I have to wear lead shoes so I don't rise. It's a pleasure to be part of these meetings. I've had the opportunity to look closely at the last 2 meetings because I edited them a little bit to take out a few of the glitches. And the product is very good, and you can be proud of the meetings you're having. We're going to use your programs here as a model for other chapters, trying to encourage them to start up digital meetings in order to get the message out to our staff. Not our staff, our members. I appreciate everything you're doing and look forward to seeing the program. Thank you.
Thank you. Thank you very much, Henry. I guess we're ready for our Duke team to talk to us about Alzheimer's. As most of you know, we celebrate or talk about Alzheimer's, particularly in the month of September. And we have a drive which is ongoing. Letters went out last week to every member asking for donations. Of course, these are all voluntary and are certainly tax deductible, and they go to Alzheimer's research only. They're not for admin costs or anything like that. So it's all deductible, and I'm very proud to say that, and I don't know exactly how many years, but I would say at least 4 or 5 consecutive years, the Durham chapter has contributed more to Alzheimer's research than any other chapter in the state. And that's something we're very proud of, and we hope that's not going to end. COVID virus has kept us from meeting and from having our raffles monthly and that kind of thing. But with our money, we have 2 line items for Alzheimer's. One is for Alzheimer's research, which all goes for that. The other is we do memorial contributions to people who pass away. So we are very, very much involved with that project. And I urge everyone to be as generous as you have been in the past. And we would be very, very pleased if that should happen.
And Carolyn, maybe one other thing to mention is that letters have just gone out to our membership from Helen Hilderman.
Right, Helen. Helen is our Alzheimer's chair, and Helen is on the call. And I want to thank you so much, Helen, for getting them all out. We had some hassles, but we got them done. It's hard to get into Crowsdale these days, and so I would meet Helen at the welcome house, and if she wasn't there, they would carry her packages to them. And then I picked them up again and we mailed them. So we got it done, and I was very pleased, and I appreciate Helen's efforts for that. And she worked very hard on that.
I think I got my letter. I think I got my letter yesterday. And if you haven't gotten yours yet, it's a letter explaining how you can make a contribution. And there is a return envelope in the envelope for sending a check in, and instructions on how to do everything. So, I also liked what Carolyn did, which was, since we had not been able to meet in person, we haven't had a chance to do the raffle and try to win the Kit Kat bar. So Carolyn has made an extra check to cover what we would have given away in the raffles. So.
Did somebody have a question?
No, I'm sorry. That was, my ring system just told me I had a delivery.
Oh, okay. All right. So with that, I would like to have Mary Vickers and Sherry Harrell introduce our team from Duke, who's going to talk to us about Alzheimer's research.
I will go ahead and introduce Reverend Edmund. He is not on the call with us yet. I just sent an email to ask if he was having trouble, but I will go ahead and read the introduction, and then Sherry will introduce Ms. Gwyther since she's here. The Reverend Henry Edmonds is a coordinator for the African American Community Outreach Program for Joseph and Kathleen Bryan Alzheimer's Disease Research Center at Duke. He is known for his work in community outreach and his dedication to serving others through ministry. His ministry has taken him from rural areas of North Carolina to remote areas of Africa. As a community activist concerned with racial health disparities, he has brought his experience to bear on the issues of Alzheimer's disease and health inequalities in African Americans. With his current work at Duke Alzheimer's Disease Research Center, he enjoys the opportunity to speak to groups about the choices to help them make decisions to improve the quality of life for their loved ones with Alzheimer's. And although he's not here, we will introduce him if he is able to sign in. But Sherry will introduce Ms. Gwyther now.
Ms. Gwyther is a licensed clinical social worker. Ms. Gwyther founded the Duke Dementia Family Support Program within the Duke Center for Aging 41 years ago. She now works part-time for the Duke Dementia Family Support Program and the NC Registry for Brain Health, while she continues as an associate professor in the Duke Department of Psychiatry and Behavioral Sciences. Lisa, or Ms. Gwyther, and Reverend Edmonds have been regular Alzheimer's research update presenters for the Durham-North chapter for over 10 years. Thank you.
We will turn it over to Ms. Gwyther at this point. Thank you.
It's a pleasure to be here, and I first want to congratulate your chapter. I knew that you had been major fundraisers, but I didn't realize you had such a long history of being the #1 North Carolina chapter in funding for Alzheimer's research. That's a significant contribution, and that's why Henry Edmonds and I have enjoyed our participation live in your meetings for so many years. This is an exciting time for us because even though we give research updates every year and try and report back to you on where your money is going, today we're going to take a slightly different tack and tell you what's happening most close to home. And what I think is exciting about it is with all these barriers presented by COVID, this is one major project that you can make a difference. You can actually be part of Alzheimer's research and be part of the solution. You've heard us talk for years about a prevention registry at Duke. Now we have the first ever North Carolina registry for brain health. It's expanded, and it's expanded for scientific reasons. We have known for the last several years that Alzheimer's doesn't start on a Tuesday, or dementia of any kind doesn't start on a Tuesday. We're learning what happens in the brain early on has major effects on what may cause or dementia to begin early or late or ever. And so we're learning that we have to take a broader brain health approach. And in research, we have to include people who may not be at the age of greatest risk, but may already have risk factors, some of which may be modifiable, some of which, like genetics, you can't do anything about who your parents were. But there are a lot of things we're learning about social determinants of health that may be modifiable and that caused us caused the state of North Carolina to say that we're going to have a brand new North Carolina registry for brain health. Now, this registry was funded by the state legislature after they heard the recommendations from the North Carolina Dementia Capable North Carolina report. And one of the things that report said is North Carolina wants to play a major role in research and learning more about brain health and what can be done potentially to prevent or treat Alzheimer's disease. So the legislature funded what was then a consortium of universities and is now called the North Carolina Registry for Brain Health. And Henry is working with that registry, and I am working part-time with that registry as well, presenting to community groups. The North Carolina legislature had two other major focuses. They wanted us to focus on people who are not well studied, more diverse populations, and populations that may never have had an opportunity to participate in research. And so that's why we're continuing our efforts, as Henry and I have for 15 years or 20 years, as long as he and I have both been in research in Alzheimer's disease at Duke, and we are continuing to do that. If Tom can share his slide, the first slide is about the North Carolina Registry, and if you can share that on the screen with, were you going to do that? You're muted.
Okay, so let me, what is the name of it? It's the...
it says Connecting North Carolina to Research and Resources.
So I've got a brain brochure, a newsletter, and an enrollment
the brochure.
Form. All right, can you see it?
No, I can see your listed brain brochure, but I can't see the brain brochure.
I've got the NC registry. Can other people see the NC registry for brain health on the screen? No? Yes?
No, I can't see anything but a list of files.
Your files.
Okay, so
to the right of that, it says this file can't be previewed.
Well, we can do it without
I see
the handouts. I can just go through the registry.
Well, I can see it on my screen, so I'm wondering why.
Can you double click on it?
Yeah. Hmm. Okay. Well, I can send it out to all of our participants. Sorry
That
that.
would be very helpful. If you could send it by email attachment to the participants, I'll talk about
I
it
will.
now, and then they'll have it for reference.
I will do that.
That would be great. Okay, I'm going to go ahead and talk about the registry. So the registry is the first of its kind in the state of North Carolina. The point of the registry is to increase awareness of Alzheimer's disease, that it is a public health epidemic, just as COVID is, and it affects probably more people in some ways. And it is a registry to connect North Carolinians of all ages. And that's what's different about what we have presented to your chapter before. In the past, our registry started at age 55 and went up as high as you wanted to go. The registry now for the whole state of North Carolina that is directed through Duke is for people 18 and over who do not necessarily have a diagnosis or who do have a diagnosis. There it is. There it is. Now, can you just go down a little bit? There it is. Okay, that's the part I just talked about. Let's stop there for a minute. The thing you should know is that the registry is now part of the registry involves 5 academic universities: Duke University, East Carolina, North Carolina A&T, UNC Chapel Hill, and Wake Forest. So we are all involved in Alzheimer's research, and you may have an opportunity to participate in studies at any one of those places, though obviously for Durham, North Carolina, Duke is probably the closest. Okay, the value of the registry. We talked about this before. Memory disorders are common. It's open to all across the state. It's the 5th leading cause of death in North Carolina. And we know that symptoms, the brain changes happen before symptoms. And so if we can help find ways of identifying people who may be at risk and who are still functioning fine and who are able to remember and think in the ways they always did and manage their own lives with good quality, then we will have done a tremendous amount in Alzheimer's research. We're obviously not doing this all by ourselves. There are researchers all over the world working on this. What's unique is that this is just for North Carolina. So it was created to get local brain health experts from the 5 partnering institutions together, and they are working together to understand and improve brain health, to host outreach events like this talk today, and to publicize resources available in communities that may be helpful to people who are already affected or who want to know more about what they can do for their brain health as they age. Next, can we go a little further? There's a 3rd page of that one brochure. Oh, so this is the only important thing here is to recognize the 5 universities participating, which are all listed here, and then to let you know the original state plan for North Carolina that funded this registry was led by the North Carolina Institute of Medicine, and they remain equally committed and involved to this project. And in addition, AARP of North Carolina has also remained equally committed. They were on the original committee task force to come up with a state plan. And this is the only part of the state plan that specifically addresses research, which is your chapter's interest. Okay, if we can go to the next slide, I just wanted to show, the next handout that I gave you, which says newsletter on it, September or summer newsletter. North Carolina Registry newsletter, summer 2020. Everyone who participates, I'll go ahead and talk about it while you're showing it. Just show the first page, that's fine for now. Everyone who participates, who signs up to be a participant in this North Carolina Registry, and we have over 5,000 people, and uniquely 20% or 20 to 30% of whom are African American. So we have one of the unique registries in the country in terms of having African American participation. We're hoping to expand that as well. So part of the registry's goal is to educate North Carolinians about why research is so important. And to do that, we publish a quarterly newsletter, and this current issue of the quarterly newsletter, if you can bring it up, we always have what's going on now and links to important parts of information about research. And thank you, you've got it up. Okay. Oh, no, you don't. Well, anyway, you can get the research newsletter by joining the registry, and Henry will tell you about how to do that if he can get on. But let me just give you a sample of what's in the registry. Today, this issue of the registry starts with a really important report. There it is. The Lancet Commission issues a report on recommendations to reduce dementia risk. This is a major event taking place for Alzheimer's Month in North Carolina. You don't have to open the Lancet report, but just know that it's there, and it talks about how you can reduce your risk of Alzheimer's, what's been proven, and what they have the best evidence on. If you can go to the second page of the newsletter, it includes a story about the director of our North Carolina Registry at Duke, Dr. Kathleen Welch-Bomer, who's been at Duke working with us for a long time and directed our research efforts at Duke. She went to an international conference this summer called the Alzheimer's Association International Conference on Alzheimer's Research. She was part of a panel making a major presentation on Alzheimer's from a public health perspective and the recruitment for research studies on dementia. The major point of this whole international panel was that the rate limiting step in our learning anything from research about Alzheimer's is having adequate numbers of diverse populations to participate. And so she talked about what we were doing in North Carolina, and her presentation is available through this newsletter. Can I have the next page, please? One of the things that was the highlight of the international conference was talk about a potential blood test marker for people who may be at risk, who may have Alzheimer's or related dementia. And there's been major progress this summer in that blood test marker. It's not ready for diagnosis yet. It's not ready for general use, but it's one of the most exciting developments in the potential prevention and treatment of dementia. The next page of our newsletter always lists, and you can stop there for a minute, always lists major events. And first of all, this September is World Alzheimer's Month. There's a lot of major events related to that. There's also some workshops that we're offered in North Carolina that are available for video links, so you can look at them afterwards. One is on understanding Lewy body dementia. One is on new assistive technologies for people living with early memory changes at home. And one of the real helpful resources is from the Duke Dementia Family Support Program where I work. And it was 2 occupational therapists giving a presentation for people who are living at home with someone with dementia, talking about what are we doing today and how can we do it well. And many families told us this presentation, which is available to you whenever you have time, was one of the best things they heard about how to help a relative you're living with who has a moderate stage dementia. Okay, can we go ahead? The next page. Oh, this page at the bottom has some fun things. One of the most exciting, for me anyway, research findings has been the importance of music and how music can do so much for your mental health, but it can also do a lot for your brain. And this is an international tip sheet that just came out that talks about what you can do with music to improve brain health. And I encourage those of you who are able to look at it. It's also just fun for the music lovers. Can we go back to the newsletter, page 3, I think? Yeah, let's go ahead through past Tune Up Your Brain. And then, yeah, after that. Is that the last page? That's the last page. Okay.
Yep, that's the last page.
Okay, thank you. Anyway, that's just a sample. There's also what are called e-news blasts that go out to people, for these 5,000 people from North Carolina in the registry, that let them know about new studies going on. You should just know that already since the registry started, they have contributed people who were interested in participating, one in an exercise study, one in a study using computers for brain health and mental status training. And both of those couldn't have been done if they didn't have easy access to a number of people, some of whom would meet the qualifications for that particular study. That's why it's so exciting. It speeds up. You've all heard how long it takes to do research and how many years, even for COVID vaccine trials, it's going to take to have a safe, effective treatment. Well, there's a whole lot we can do faster if we have access to people who are willing to participate. Joining this registry does not commit you to participate in any single study or any study. It does provide regular access to information so you can know what's coming up and what to do. What we're learning is that all the people who were on the original Duke registry, we are trying to contact them. And what we're learning is the only way we're going to be able to contact people in the future is if they have email or a cell phone with text capability. So we're specifically interested in having people who have access to email or a cell phone text, because during COVID, research face-to-face is very limited. And so what we're going to be focusing on are studies that can be done that don't involve people leaving their homes and that do involve use of email or text or being online if you can be online. So that's why we're focusing on that. And if Henry is on, he could take it from here. If he can't get on, I can finish it.
Yes, he's on.
Oh, great.
So Henry, if you could unmute, there you go.
Okay, I'm going to just follow up and thank you so much, Mr. Link and Lisa, for doing a good job You've probably done everything that needs to be done, but we definitely want to thank all of you for joining us. I think it's about 17 persons online.
20.
20? Okay. 20 persons online, and that's a real good thing for doing things virtually at this time. And you have the form up that I wanted to talk about, and that is the North Carolina Registry for Brain Health enrollment form. The enrollment for the North Carolina Brain Health Registry is very simple. We ask questions that we need in order to facilitate your enrollment into various studies. Filling out the enrollment form does not actually put you in any study. It just gives us your information for the registry so that we can contact you about studies that are coming up for brain health. Now, the studies that will be coming up will be from the 5 institutions, including Duke University Medical Center, Wake Forest University, UNC Chapel Hill, East Carolina, and also North Carolina A&T State University. All of these institutions provide information into the Brain Health Registry, and they all have studies dealing with prevention programs dealing with Alzheimer's disease. So once you fill out the enrollment form, your name goes and information goes into the registry. Again, the registry does not mean that you are actually in a study. This gives us your contact information so that we can contact you about studies. Now, in order to get into a study, you have to fill out the enrollment form. And that address is very simple. It's one word. I'll spell it out for you. It's ncbrainhealth.org. Again, ncbrainhealth.org. I'll spell it out for you. ncbrainhealth.org. You can go to that address and fill out the form that you see online. Well, it was online. And once you fill out that form, you will be in the North Carolina Registry for Brain Health. And I think that's all I need to say. The Registry for Brain Health is just simply a mailing list for people who are interested in learning about ongoing research studies in North Carolina that are designed to improve brain health and prevention of such conditions as Alzheimer's disease. If you are interested in learning more about this ongoing research or getting involved in these types of studies, please go to that address that I just gave you, North Carolina Registry for Brain Health, and join the registry. Are there any questions?
I have a question, if I may ask, Henry. How are you?
Sure.
This is Davis Capps with Brookdale. I see that both you and Lisa mentioned that you like to have a younger population join the registry and getting more people 18 years and up participating so we can get a broader scope on things. Do people that young, in addition to my work with Brookdale, I also coach a lot of youth sports. A lot of kids get concussions. They come back from the concussions that aren't showing any signs of any, ongoing problems with it. Would they be good people for this registry? Do they have to have problems with their thinking or recognition type thing, or is it just anybody with any underlying effects? Is there a established criteria, I guess, for young people is what I'm saying? Thank you.
No, Thank you for that question. Very good question. Thank you. No, there is no criteria. You do not have to have memory issues at the time you sign up. But if you do have memory problems, yes, you can still sign up. We are looking for persons 18 years of age or older. And this is really different from what we have done in the past. In the past, we were looking for persons 55 years of age or older. So now we have gone down to 18 years of age. We found that a lot of studies right now are dealing with younger people, although we do not have any at present that are dealing with younger people. There will be some coming along that will deal with younger people. Does that answer your question?
Yes, sir. Thank you very much.
Thanks for that question.
This is Carol in London. I have a question, a couple of them, in fact. My husband and I both signed up last year for the registry. We've never heard anything. Are we supposed to hear that you've received it, or will we hear only if you have some study you think we could participate in?
I'm going to write your name down. Right now, what we're doing is going back through that list to make sure that we have all of your contact information and can get in contact with everybody. You should have heard from us by now. What we've been doing recently is contacting everybody that we had in the registry, both registries, the old registry, the Duke registry, as well as the North Carolina registry for brain health, to make sure that we have all the information and that we can get in contact with you. So I'm going to take your name, Carolyn London.
Right, and Frank London. We signed all that paperwork at last year's meeting and sent it to you. We didn't hand it to you at the meeting, but we mailed it later.
Okay, that may be a problem. Okay, I'll make sure that we do have your, if we don't have your information, I will be in touch with you. If you give me an email address.
My email address is cclondon at att.net.
What we're trying to do, can you all hear me?
Yes.
What we are trying to do is make sure that people, even who signed up last year, are being asked if they'd like to be part of this larger statewide registry. And if they would, we want to make sure that they're getting regular e-newsletters, like the one I showed you. So if you haven't even gotten e-newsletters or e-blasts, somebody should have called you to ask you if you want to continue to participate in this larger group and get the regular updates. So it's worth it for Henry to check that out.
Okay, fine, thank you.
I want to make sure I got your address correct. Just a minute. Did you say CC London?
Yes.
At ATT.net. Right.
And Reverend Edmonds, I will send you via email her email address as well as mine.
Okay. Thank you.
Thank you. The other thing I was really interested in was about the biomarkers and the new blood tests that we've read about. Is that being used, or is that in trials, or what's the status of that?
I can try and answer that. Right now, it's only used for research purposes. It is in trials. There have been a number of trials that they were very excited about because it looked like it differentiated people who would be at greatest risk, and it was the least invasive test that we have so far, a biomarker test that wouldn't hurt and wouldn't cost a lot. Mm-hmm. And so they're doing testing all over the world on blood biomarkers. Right now, it cannot be used with any authority, validity, for diagnosis or for prognosis on who's going to be affected. So it's still a research blood test.
Okay.
If people who are participating in other research studies may also end up participating in studies of all sorts of biomarkers. And actually in North Carolina, there are a lot of biomarker studies going on right here. But it's not quite ready for prime time, but the links in the current newsletter, which you can get at the registry link that Henry mentioned and that you were shown, anyone can go in there and look at the newsletter and click on the link that talks about the blood biomarkers and what the reference to it was. And you can look at the latest summary of the research.
Thank you very much. I've heard all along that if your doctor tells you you have Alzheimer's, that is not necessarily the case. I had heard that you only know with an autopsy if someone really has Alzheimer's. Is that still true, or?
Yeah, that's something that's been going around for a long time.
Sure, yeah.
Autopsy confirmation is still the gold standard. Most people don't get autopsies because research or private individuals can't pay for it.
Mm-hmm.
We are learning a whole lot more now about what to expect clinically, but we're also learning that there are many variations of Alzheimer's. Many people have mixed dementias with more than one cause. So when they do autopsies, what we're finding is that people may not have pure Alzheimer's. We thought they had Alzheimer's. Clinically, the doctor thought by the way the disease progressed, we thought it was Alzheimer's. Turns out they did have Alzheimer's, but they had changes in their brain indicative of other common causes of dementia, like Lewy body dementia or vascular dementia or some type of frontal lobe dementia. So we're learning it's very possible to have mixed diagnoses. And it's very possible that some people we think have Alzheimer's primarily have another form of dementia and it just wasn't picked up clinically. So autopsy continues to be important in major studies that can afford autopsy confirmation of people who have been well studied over time. Autopsy in and of itself, if you just do an autopsy on someone for whom you have no early clinical information, it's not that valuable to the person or to research. What we need are people who are followed over time and who we have multiple testing points on them to compare to what we see on autopsy in order to learn what might be useful to that individual and their family, as well as to research in general. So the bottom line is physicians are being trained, and that's one of the major focuses of our registry, is to also get this information to physicians, are being trained into how to do a good clinical evaluation. And right now, that's the best we have to offer. We're trying to encourage earlier diagnosis, which is very important. When people can make decisions and when they can get treatment of other conditions that may make their thinking and memory look worse, there's a lot of good reasons why you should consider early diagnosis. If you think something is changing and you're not quite sure, it's always worth checking it out. And we're trying to encourage nationally, there's a major effort, and internationally, to focus on early diagnosis.
So if your doctor tells you have dementia, that's pretty accurate. But if he tells you have Alzheimer's, that may not be accurate.
Yeah, dementia is an umbrella term that
Sure.
describes people who have thinking and memory problems that interfere with their activities of daily living. It's really interfering with their ability to live the life that they used to live. Many people have what's called mild cognitive impairment, where they're starting to have some memory and thinking changes, but it hasn't had major consequences on their functioning and ability to live independently. So dementia is the broad category of all causes of memory and thinking disabilities that are significant enough to interfere with your normal functioning.
Thank you very much.
You're welcome.
This is Henry, Reverend Edmonds, and I think it's important to understand that mild cognitive impairment, as Lisa was talking about, or dementia, some dementia, can be moderated by changes in medication or other things that you can do to reduce that form of dementia.
Right. There's a lot that can be done besides taking a pill that we don't have that will reverse or stop the progression of a dementia that is already in progress. And what we're learning is what Henry has been talking about. Often people think and remember worse because of medication interactions or medications for which they can no longer tolerate them for a variety of reasons. Or they're not being adequately treated for other chronic diseases, and their brain becomes their most vulnerable organ. So anything that affects another organ in their body shows up as a brain symptom. So even people who have mild cognitive impairment or dementia can function a whole lot better if you treat everything else that is treatable and may be interfering with their thinking and memory. And that's why we really encourage people to pursue, if they're having real difficulty doing what they normally do and what they want to do themselves, to pursue some form of a diagnosis or evaluation.
So are there any other questions?
I have one. Sherry has one.
Sure, go ahead.
Okay, I would like to know if someone has a traumatic brain injury, are they at increased risk for dementia?
I can answer that. They used to believe that traumatic brain injuries where you lost consciousness for 30 seconds or more, or 30 minutes or more, I'm sorry, particularly young, when you were very young from like athletics and things like that, had long-term consequences in the later development of dementia. They're now thinking that traumatic brain injury at any age may have an effect on your risk for dementia. So it's certainly something that they always...
Andrew Yurosevich.
Join the meeting.
Yeah, go ahead, continue, Lisa.
It's something that they always ask about now. And a physician will always ask about history of and current traumatic brain injury. But it is one of the risk factors. It's not one of the major risk factors, but it is one of the risk factors. The major risk factor, unfortunately, hasn't changed since Henry and I started doing these talks 20 years ago, and that is age. Advancing age is the major risk factor.
Okay, anyone else?
What about a person who has epilepsy? Is that a contributing factor, or because when they have grand mal seizures, they sometimes bang their heads and do all sorts of things that could possibly or appear to be possible danger to the brain. Yeah.
Yeah, there are a lot of brain diseases that they think may be related to later development of dementia. I'm no expert on epilepsy to know what the connection is.
Thank you. Well, if there are no further questions, we'll go on with the rest of our meeting. We thank you very, very much for coming and sharing with us today.
Thank you, and thanks so much for all you've done over the years in raising funding for Alzheimer's research. We really appreciate it.
I also wanted to thank Gail Crowley and Anna Cox for helping to get the letter together for our drive this year. I forgot to mention them when I mentioned Helen, but both of them worked on that project as well, and I'm delighted to have had their input. One other thing about the Alzheimer's research is that NARFE nationwide has contributed $13 million to Alzheimer's research. So over the years, I don't know how long we've had that partnership with them, but I think the goal was 13 million in 2021, and I believe we were already there. So we're very pleased about that as well.
Thank you very much, Reverend Edmonds and Ms. Gwyther. It's a wonderful presentation. I will send out your attachments to all of our members, and thank you very much.
Thank you.
Thank you so much for having us.
Yeah.
I would love to sign up for your newsletter.
Great.
So shall we continue with our meeting then? I'm not sure who's here, but I have Nancy Mayer, who is our legislative officer, next. Are you with us, Nancy?
Yes, I am. Can you hear
We're
me?
ready for your report.
Can you hear me? You want to put me on speaker, Tom?
Yeah, you're on.
I'm not big. There I am. Hey, I like to be big. You see, I taught a Red Cross class earlier today. You see my Red Cross thing? I taught a CPR first aid class earlier this morning, but I got back in time.
Nancy, you are big.
I know. I really try hard. Okay, guys, let me get back into this. And just like I've been doing, I'll send this out. I have all the links here. So if you want more information on anything here, all the links will be open. It will be on the thing that gets sent out. Does it get sent out before the next newsletter or just when we announce the next meeting?
Actually, I attach it to the next meeting as an attachment. I sent out your last month's legislative report to this meeting. So there are a bunch of attachments on this meeting and your last.
Okay, I'm just saying that people may want to get it faster because there's always some voting information.
I can always, I can send it out faster, and also add.
Okay, I think it'd be a good thing because some of the stuff is really quick.
Okay.
Okay, the first thing is the open season for our health options and the federal health plan plus the vision and the dental care is coming up. It's going to run from November 9th until December 14th. So that's open season, guys. You all know what that means. TSP to increase automatic enrollment contribution to 5%. If anybody knows anybody that's working for the government, they have to give 5% to get the full 5%. But it's certainly something they may want to think of if they're building up their TSP stuff. CDC issues sweeping temporary halt on evictions nationwide amid pandemic. This is issued by the CDC. You can't evict anybody from their homes for non-payment. this has to do with rent. It doesn't have to do with mortgage. But if you know anybody that might be evicted because they have not been able to pay their rent during the pandemic, let them know, because the CDC has issued this sweeping temporary halt on evictions. NARFE, I'm going to be taking a class on that next week too, so I can help people. I've been participating in a lot of online pro bono stuff, so that's one of the things I'm going to be learning about. NARFE issues statement on payroll tax deferral. They're going to be deferring tax, but they don't know how they're supposed to be paying it back. And they think people should be warned if they're going to have to pay. If it's just a deferral and it's not a forgiveness, people need to know so they can save the money up and be able to pay their taxes when they're due. Something to keep track of. Let people know. Okay. When, where, and how to get your flu shot. I got this from AARP. If you're 65 or older, which includes me now, guys, I'm now one of the 65 and older people, that we can get high dose, and we can get the high dose 4 quadrivalent. We used to only be able to get, there's a regular quadrivalent for people less than 65, younger than 65, but if you're 65 or older, you can ask for the super dose of quadrivalent. You do want the quadrivalent, not the trivalent. Best time to get is from mid-September through the month of October. So starting this week is a good time to start getting your flu shot. House Democrats seek answers on payroll tax deferral order. This is the same thing we talked about, the payroll deferral. The Democrats are asking for clarification. It's unclear. You know, anybody who's working, who's getting a tax deferral, make sure they put aside the money because they're going to be owing it. Military retirees with TRICARE Select Insurance face annual fee. For the first time, military retirees with TRICARE Select Insurance are going to have to pay a fee. So if you're getting TRICARE Select Insurance, make sure you know you're going to be paying the fee, because if you don't pay the fee, you won't be getting your insurance. Members must arrange for their payment before TRICARE's open enrollment period, which ends on December 14th. So guys, as I said, if you have TRICARE Select Insurance, please make sure you make arrangements. The COLA watch. We always care about our COLA. It's now looking to 1.4%. Not a bad, it's better. Well, 1.4% is what they're looking at right now for our COLA. You know, that's not finalized till it's finalized, but that's what it's looking at right now. Okay, for the state, North Carolina moves to phase 2.5, effective September 4th. So it's been a while. It includes mass gathering limits will increase to 25 and 50 people outdoors. So you can now have more people indoors up to 25, up from 10, and you can have 50 outdoors up from 25. Playgrounds may open. I've already seen my granddaughters being on a playground, so playgrounds may open. Museums and aquariums may open at 50% capacity. Anybody want to go see the Museum of Art? You can now get in, but it's 50% capacity. Gyms and indoor exercise facilities such as yoga studios, martial arts, rock climbing, as well as skating rinks, bowling alleys, indoor basketball, etc., may open at 30% capacity. Bars, nightclubs, movie theaters, indoor entertainment facilities, amusement parks, dance halls will remain closed for now. Large venues remain subject to mass gathering limits. So even though they're open, they are limited to the mass gathering limits, which was the 50 and which was the 25 outdoors. 50 outdoors and 25 indoors. So even if you have a mass gathering, you're limited to that. I have the executive order linked here. You guys can read all you want. There's a lot of questions about this, and they're linked here as well. Now, North Carolina schools can reopen. K through 5 can reopen starting October 5th. But every county is going to make their own decision on this. So it's unclear whether the people you know of that are K through 5 are going to be able to attend school in person. But depending on the county, the state is letting them open starting October 5th. There's more here. The link is here. North Carolina state legislature passed nearly $1 billion spending bill on Thursday that could use the rest of the state's share of the federal COVID relief money. A whole bunch of things that this money was spent on. There's a big list of funds here. When you get this, you can see there's stuff going to Medicaid. There's stuff going to nonprofit nurse family partnerships. There's the Duke University Human Vaccine Institute research, whole bunch of stuff got money, all listed here. When you get this, you can read if you want to know if your favorite thing got money. Judge Leandro case, remember Leandro, that's the one you have to have, everybody has to have opportunity to good schooling, has approved a $427 million action plan to improve state schools. State monies, but state lawmakers have to find the money, and you know the current legislature is not looking to spend money on this. So even though the court says they have to come up with it and spend it, I don't know if that's going to be happening anytime soon. 1 month into the fall semester, COVID-19's impact varies along across NC campuses. As you know, UNC went about 2 weeks before they had to close down and go virtual. State went about 2 weeks before they closed down and went virtual. However, other universities like Appalachian State, UNC Wilmington are staying the course and hoping to make it through. Duke University has only reported 52 positive cases as of late last week, faculty and staff since August 1st, and North Carolina Central has only had 39 positive cases. So there's 2 places locally that have managed to stay the course and are still open. Don't know how long that's going to last, but it's open for now. In the county, this is the voting stuff. Everybody always wants to know what's happening with voting. If you vote in person during early voting and on election day, Durham County has many requirements for COVID-19. They have to have PPE, you're supposed to wear a mask, all this kind of stuff, single-use pens. It's important to know that that if you want to vote, if you got your absentee ballot, I got mine. If you want to go vote, you can. There's another. You can mail it. You can mail it. You can carry it in early your voting, or there's another option that I took. There's a tent at the Durham County Board of Elections. Orange County has this too, Tom, for you.
Yeah.
The tent at the Board of Elections, you can go in and vote now. It's outside. You don't have to go inside, and they'll do it all for you. I did it 2 o'clock last Tuesday, 2 o'clock in the afternoon, no waiting. There's parking there. It's great. So anybody who has absentee ballots, I would strongly suggest you go and vote there. It's outside. You don't have both. If you and your husband or if you and your spouse both have stuff, only one person has to go because the spouse can turn in their absentee ballot for the other spouse. It's 9 to 3. Yeah, the tents are open 9 to 3. I strongly suggest you do that. I think it's the best option. You don't have to rely on the U.S. mail.
Nancy, that's a drop box you're talking about.
No, it's not a drop box. It's a tent with people in it.
Yeah, but
they're actually accepting the papers and everything. There's 2 people that are staffed in Durham. I don't know how many staffed in Orange. It's not a drop box because the drop boxes were never authorized by the State Board of Elections. So both Durham and Orange, and I understand Wake County as well, have gotten this middle deal when they have people waiting outside, weather permitting, in tents to take your papers, and they have plastic up the whole bit. It's very safe and it's outside.
Nancy,
Tom, does that answer your question?
Nancy, you said the word vote. Did you mean vote or did you mean turn in your ballot?
Turn in your ballot, yes.
Absentee ballot. So this is not voting.
No, it's turning in your absentee ballot. So you're voting with your absentee ballot. Sorry, I was a little short. You're right. You're turning in your absentee ballot. Nothing's going to get counted till 2 o'clock on election day. Make that clear. They're processed before, but they are only counted on 2 o'clock on election day. They get completely processed. I believe that means at 2 o'clock on election day, they press a button and they get the count. But nobody's going to be looking at the numbers until 2 o'clock on election day.
Nancy, when you did your turn-in, did you still have to have the witness and all the information on the outside? You just basically did it to
absolutely.
somebody.
Yeah, they will not witness for you. You have to have your witness sign. You have to have them have all the information. One of the things I understand, which is a common problem with these absentee ballots, is the witness is not putting their information down. You have to have their address down when you submit it. So make sure if you have somebody witnessing your absentee ballot that they fill in their address. That's something that's very, very common that people are forgetting to do.
I think it's also
the one thing people are having when they find problems with these ballots is that the witness has not filled in all the information they need to fill in. They need to fill in they need to fill in the address, and they need to fill in their name, and they need to sign. So you print it one place, you sign it one place, and then you put the address. Make sure you do it right. It's very specific. You got to do it right. But you can bring in that envelope to the Durham County Board of Elections like I did. They give you the paper to fill out saying, I was self, but if David filled mine in, he could have, if David brought it in, he would have been able to bring it in, and he would have been able to sign and say he was my spouse, and it would have been valid. So not everybody has to go in, but I filled mine own in. I brought my own in, so I put self down. If David done it, he would have put spouse.
I wanted to let you know that I submitted mine. I got mine on a Saturday, the day after they mailed them out. I filled it out. I mailed it on Labor Day, and I got a confirmation on that Friday. Online, I got a confirmation that they had received my ballot by mail. So it went back quickly.
Dave got the same thing. Dave put his in the mail, and he got confirmation. We've already been talking about how to check your thing. They have ballot track, and you can track it, and you can see what's going on. But for my money and what I did, I feel better having brought it in and carried it to someone and handing it to them.
Nancy.
You can do either one. You can track your ballot. It's called Ballot Track, and you can get all the information on how to do that. Ballot Track's only been around for about a week, but it is working. It worked for Dave, and it worked for the person on the phone, on the call as well. So Nancy, you can mail yours in and track it, or you can bring it in like I did.
Nancy, isn't one of the other issues is the signature match? Where
they're not checking that in North Carolina at this time.
Okay, so because I was wondering, like, how do you see exactly what they have on file for you to make sure?
From what I understand, they're not doing signature matches in North Carolina for this election.
Okay, thanks.
And I asked that question, and that was the answer I got.
Okay.
Now, whether that's true or not, I can't absolutely verify, but I'm telling you that's what I heard.
Nancy, this is Pete Eckhoff. Can you hear me?
Yes, I can.
Okay. If you do have problems, somehow your address isn't done right or some of the procedure, how fast do they get back to you?
They've been getting back to people in about 3 or 4 days and telling them to resubmit it.
Sounds good. Thank you.
And they'll tell you how to do that when they get back. Okay. I don't know exactly how it's done, but people have been doing that.
Well, that's good to know.
Okay, some data reflections on COVID. Okay, the 7-day moving average was 28. This is a decrease from 38 last week. We're also down to, we're below 5% positives. Jane, I know that means a lot to you. I think we're 4.5 or 4.6%.
Aren't the numbers of tests down though as well?
Yes, they are down as well, but our percentage positive is down, below 5. Just saying, at least that little piece of information is good. Hispanic and Latino individuals are still overrepresented in Durham County. 40% of the cases are Hispanic and Latinas, while only 14% of the county's people identify themselves as this. Black and African Americans are proportionally represented, and white individuals are underrepresented. So this is still being carried by our Latina and Hispanic neighbors. They're the ones that are getting sick, and it's really, really bad for them. The greatest number of people that are getting it were unemployed people and were Hispanic unemployed people at 77.27% female. So you're looking at a lot of female Hispanic unemployed people that are getting the disease. The number of unemployed adults in Durham County has increased by 11,800 during the month of March. 80% of the cases associated with construction workers were Hispanic. Somebody mentioned that a couple of months ago. Hispanic community that is a very large part of our construction community in this county are still getting very, very heavily impacted by COVID-19. So people in construction, the Hispanics that are in the construction industry are really getting sick a lot.
What about age?
30% of the cases are associated with nursing care facilities are Black and African American. I suspect those are the janitors and the lunchroom staff at the hospitals and the other health places, but they didn't get that specific. Distribution of the employment sector. Okay, I have more information here. The raw data for September 14th is looking really good. But Hispanics are still getting hit hard. They think it's because they live in crowded multi-generational homes, work in service jobs that cannot be done remotely. In other words, they're not allowed to do telework, and they rely on public transportation. So that's why they think the Hispanic community is taking such a hit with COVID-19 in this county. To see more information on what's going on, it's on the, I have a link here. It's on the same, link I gave you last time, but it's still there. It's the dashboard. You can see all the numbers and all this information. I just thought you might like to hear what's going on. And then, of course, Justice Ginsburg died last Friday, and some people want to replace her very, very fast, and some people want to slow it up till after the election. I'm not going to get into the politics on that, but it's going either way, and I have no idea which way it's going to be going at the moment. Anybody have any questions on any of this? Yeah, Tom Link, you're right. We can all get free COVID testing. I've already gotten COVID. I got COVID tested at the Red Cross when I donated blood about 7 weeks ago, and I'm going to get tested again on Thursday because I'm donating blood again at the Red Cross on Thursday. So I'll get an antibody test again on Thursday. I was negative, by the way, guys. I was negative when I got tested 7 weeks ago.
Actually, the link that I sent out is for a free COVID test kit. If you that's paid for by Medicare, that is sent to your home, and you do the test yourself, and then you mail it back to LabCorp in North Carolina, and you get secure test results within 48 hours. Now, I have just received mine today. That was the doorbell that was, and so I'm not sure I'm gonna be able to stick this long swab up my nose myself, but I'm gonna try it. So,
okay.
I mean, I don't think that I have. I don't think I have it, but I mean, it is free to test. The unfortunate part about the test kit is it does not tell you if you have antibodies.
Well, I'm going to be, I'm having a medical procedure in November, and before I go in there, I'm going to get a COVID test, just like you're talking about. So I'll find out before that procedure whether I'm positive or negative, not just the antibody test, but to actually find out if I have COVID. Antibodies just say that you have developed antibodies. It's not quite as good as the direct test, which is what I'm supposed to be getting when I do the medical procedure in November. Anybody have any other questions or thoughts on this? I'm still trying to keep you guys up to date on everything as best I can. And I tell you, with my lack of sleep because of RBG dying, it's been hard. I'm taking this more personally than I have any death in a long time. So,
can I make
any other questions?
Can I make a comment about the CDC?
Go ahead.
Right now, my comment is the CDC's in turmoil. Redfield came out and very clearly told Congress that you should wear masks, you should socially distance, and that we are not going to have a vaccine before November. Trump then basically said he was confused and he knew more than the CDC director. A study came out by the CDC that showed that if you had been going to restaurants to dine in, you were twice as likely to have gotten COVID than if you had not. And there are several newer studies out about transmission in the air, not just 6 feet, but if you're in a poorly ventilated area and you're there for a long time. The CDC on Monday put out new guidance that said, yes, it's more airborne than we thought. And then the same day took the guidance back.
Well, what I read, Jane, what I read is that Fauci is saying the 3 places you're most likely to get it are eating inside a restaurant, going to a gym, and church services.
Yeah, and he's right. And you know, especially eating inside, if you're in a small space, it depends on, you know, the airflow. And you're singing or talking, you know, to eat, you have to have your mask off. It is an airborne disease. And yes, the restaurant industry is hurting, but if you go in a restaurant, you have a higher risk of getting COVID. And yes, Redfield is right. One of the best things you can do is wear your mask, and not as a chin protection unit, but over your face and your nose and your mouth. And so it is really hard, you know, for the public to trust what the CDC is saying with what is going on with the president saying stuff about a vaccine. Confidence by the American people is less than ever that they would take a vaccine right now that would get rushed through without any safety. The vaccine makers have been very clear they will not rush something through. But there's noise that Al-Azhar can force a vaccine out. I'm sorry that it's such a mess and it's become politicized, but it is such a mess. And Russia, who last month was claiming that they had a vaccine and all this stuff, and they were going to skip clinical trials. Well, they haven't given it to anybody. So maybe they thought better of it all blowing up in their face if they gave something that, first of all, you don't give people a vaccine unless you know it works and it's safe. And we are just not going to know that until the end of the year. And it's not going to be widely available until next summer for people to get. I mean, that's just the reality of it.
Thank you, Jane, for that. So I'm going to do a time check here. Our meeting is now at the 1 hour and 30 minutes time. So we're way sort of over right now. And I think, Carolyn, we should move ahead. We don't want to get to 2 hours, right?
Sure. I don't know if Helen is still on. Are you, Helen? No. So we'll skip the Alzheimer's report. It's probably a little early for her to have gotten anything already since the drive for the donations went out Wednesday afternoon, and some of us may not have gotten them yet. Some got it the next day, and I don't know about the rest, but anyway. So we would go on down to Peter with his treasury. Peter and Clyde Hasty with your treasurer's report.
Hi. Basically, we're solid. We have a couple of issues. One is that the W101 and A220 reports that highlight what our members are paying the dues or the monthly dues are not quite jiving with what we're receiving as far as reimbursements. They're close, and so I need to do a look at this and let NARFE know. They're having a heck of a time with the AMS. It's still not functioning as far as I can tell 100%. It's not anywhere close, and so I need to do that and get back with them. I hate to keep on bugging them, but it's one of those things with any new system and software. I did receive Helen Hilderman's letter and sent some money back to her a couple of days ago. And coming up October 12th, our book office bulk annual fee is due, and I think the consensus is that we're not going to renew it because we're using email, and it's saving us a lot of money. So, and which means that we'll have a balance, and I'll try and get our money back that we've got on balance to pay for our newsletters, and that's what I'm going to do unless I hear otherwise from our chapter board. And our working balance continues to grow, and so we're in good shape financially. The last thing is that I've thought of ways that we could continue our raffle, and it'd be too much of an accounting mess, a nightmare, I guess. So we'll have to wait until we can get beyond COVID and get back together at Bullets. Are there any questions out there? Any comments?
I have a question, Peter, and that was something I had suggested to you that I might do, and that is because we have not had the raffles, I was going to do an estimate of how much each of Frank and I do raffle tickets each time, and just send Helen an extra check for the raffle tickets only, and then my regular donation for Alzheimer's. I don't know if anybody else wants to do that or not, but it would be appropriate, I guess, Peter, to do that and to send the check to NARFE, but put on the, write the check to NARFE, but put on the memo that it's for raffle, rather than my donation to NARFE.
I think your odds would be pretty high on winning at this point.
Pardon me?
I think your odds of winning the raffle would be fairly high. In other words, you'd be getting a lot of Kit Kat bars.
No, I wouldn't eat a Kit Kat bar. I couldn't do that, but Frank can. But anyway, that's what I was thinking of doing to help finance the memorials for our people who pass away, to give her what I would have given for raffle into a separate check for raffle tickets for the year. And then the other check would be to Alzheimer's research.
What would the raffle check be made out to?
It would still be to NARFE, but I'd put on the memo line that it's for raffle.
I know, but the other one's going to Alzheimer's Association, right?
It goes to NARFE, and the letters that you receive tell you exactly what to put on those. Have you gotten your letter yet?
Yes.
Okay, the letter tells you how to do your Alzheimer's donation and what to write, where to write it to, and what to put on the memo.
Well, it says NARFE, make it payable to NARFE Alzheimer's Research. I'm wondering what you want the other check, the raffle check made out to, because I know we use that for a different thing. So what do you want?
Well, it's a different line item. Maybe Peter can give us some guidance there.
That's why I asked. Thank you.
Yeah.
Yeah, basically we have right now, we close out our Alzheimer's account once a year, and we sent a check for $256 to the NARFE research. And that means that at $25 a memorial, we can fund 10 people this year. And so I think what we would have to do is we would have to send that amount of money to National, or to Helen. In fact, it'd probably be better to send it to Helen, and then she can tell me how much was sent, and then we can draw from that.
Okay, but that doesn't tell us how to write the check.
It'd probably be to, as in Helen's letter, it would be to the NARFE Alzheimer's Research Fund.
Okay, but if we wanted it for the raffle, we would just put, if we put NARFE and then the raffle, then she would know which pot of money to put it in.
Right.
Is that right? Or
I think we need to talk
You all
about
figure this out offline.
Yes.
Yeah.
Yeah. How about if we discuss this offline?
all right.
And make it an item and as a on online board meeting at some
Okay. So that was the only question I would have had about that. We've only lost 4 members so far this year. So that would be, I've forgotten how much that would be, our contribution would be, what, $100 for those 4 if we don't have any more.
So that would leave us a balance of $156.
Okay, we'll go with that, as you said. Now, I wanted to talk with you a little bit about membership, and I seem to have lost all my records here. But anyway, we have right now 152 members who are chapter members, and there are 94 members who are national only in the area. So that would make us at 246 or something. But anyway, I've been working as hard as I can on the M112 to try to make sure that everybody who's dropped their dues knows they've dropped, and I'm contacting them all. I have 3 or 4 who are planning to renew, and I have 2, I think, who are interested in going with dues withholding. The incentives for the dues withholding are, of course, a 25% reduction in dues, which are right now 40. And if you do dues withholding, then it becomes 34. And the Federation will give everybody who switches to dues withholding a $20 incentive. And in order to process those, we have to get those to Sam Crane, who's the Federation treasurer. So they can't just do that online or whatever. They need to let me know, or at least get it to Sam Crane. So what I've been telling people is if they send it directly to me, then I'll get it to Sam Crane and we can get it processed. And then they give each chapter $5 for every person who converts to dues withholding. So those are some things that we can do to add a little bit to our chapter revenue. It takes away from the Federation revenue, but anyway. Also, I may have mentioned this to you before. We're not going to, at this point, have any health fairs that are going to be face-to-face. The healthcare providers are mailing their information to each federal agency about the open season. And then what I am doing is I'm contacting everybody that I know in the federal agencies where we've had health fairs before. I'm trying to get applications and forms and everything to those people. I will either hand carry them or mail them. I've already given a box to Andrew because he was working with somebody at the VA. But we're still waiting to hear if we're going to be able somehow to participate virtually with health fairs. And right now, I'm not very hopeful about it. It doesn't seem like it's going to happen. But if you have any thoughts about how we can get the word out there, let me know. I'm hoping that with the Davis Capps, who is here today, who wants to do something to help us, I'm hoping he'll help us with something like advertising or I'm not sure. We'll just have to wait and see. We have not discussed what he wants to do, but Henry and I are going to meet with him and find out what he has in mind before we make any demands. And with that, that's all I can tell you about the membership. I'm also struggling with the reports that are coming out of AMS. I reported a death, and 2 weeks later, it's still not out there. So yesterday I called them again, and they've now put it on there. But when I reported the death, she no longer showed up as a member, and she didn't show up as deceased. But they've fixed that now. But we've lost 4 people this year. We lost Mr. Mebane, who came to us through the Alamance chapter, and we lost one of our honorary members on the 4th of December. And I don't know how many of you knew this lady, but she worked for Social Security for a number of years. She's 97 years old, was 97 years old, and her name is Frances Hennett. We also lost a person who was with the post office, and his name was Larry Straub. And then we lost a person whom I had never heard of, whose name was Merritt. I've forgotten what the other name was, but anyway, so far we haven't gotten the 10 or so deaths. We've had a lot more in past years. So with that, is Fred with us? Fred Hawkins.
He's not on.
Has anybody heard anything from Fred?
I have not heard anything. I sent him an email and asked him if he had anything to report, and didn't receive a reply.
I have not received a reply either. I sent him emails, and the last time I heard from him, he told me he had COVID and was isolated, and he would be in touch with me, but he has not responded to any of my emails or my phone calls, so I don't know.
Carol and Tom, this is Anna. I did hear back from Fred, and he was doing better, and he was getting out. So that was maybe 3 weeks ago. So I thought I'd let you know that. Yeah.
Well, thanks. So last time I talked with him, I think he had 2 or 3 more days that he had to be in isolation, and he said he was not feeling very poorly as a result of the COVID. He must have had a very mild case. Now, so we'll move on to Dave with the newsletter. Dave Salmon.
Yes.
Hi, it's time for the October to December newsletter. I already have a submission from Carolyn and also from Mary with information about the speakers for the next couple of months. And so if anyone else has something they'd like for the newsletter, please send it to me in the next week. I'm going to try to get the newsletter done and out in like 2 and 2.5 weeks. I definitely need to have it done before the 15th October when in-person early voting starts, because we'll be poll watching again and won't have time for anything else. And that's about as late as we should be with the newsletter anyway, to make sure it's out in plenty of time for the October meeting.
Is it possible for you to please just include the phone-in numbers for the people who do not have email access?
You mean for the Zoom meetings?
Yes, because it wasn't the one that was on the last mail. One that went out is no longer the correct one for some reason. And I was just hoping you could put the phone numbers for just telephone call in on the newsletter that you send out by snail mail. Thank you.
Oh, sure. Okay. An update. You want to update in the newsletter, or you want it just, is that what you're suggesting?
Yes. I think that the last newsletter had an old number that no longer is functional. I checked it and it doesn't work. I checked it today, and that's the last one that the newsletter had. And I've given the number to three people, Beulah and Helen and Martha Covington. I gave them the number that came through on the email, but they didn't have that from the written, the snail mail.
Okay, so one thing that we can do is for me to publish those telephone numbers on the Facebook, if they can get it that way.
These people do not have any kind of access online. They don't have email. They don't have Facebook. They only depend on the mail, the snail mail information they get.
Okay, so
Perhaps we need to update it in the newsletter.
are we still sending out hard copies of the newsletter?
Well, they have
everyone who doesn't have email. Yes.
Oh, okay, all right.
They haven't received any since the last one they got was the April, May, June one. And that one and I had the number from that, and I checked this morning. That phone number that's posted in there, although it's different from what the email says, is not the correct one, and it doesn't work. I did check that this morning. So the current one needs to go out in the snail mail. So these people who do not have email or Facebook or any kind of, phones can be able to use that to dial in.
Okay, we can do that.
Thank you.
Now, does anybody else have anything we need to cover today?
The only thing I would submit is that we need to tighten up our time on the agenda for the next meeting, because we're at 1 hour and 45 minutes today.
Well, we normally meet from 11 to 1.
Right. But we're not eating on the computer.
Gosh, that is right. Why couldn't we arrange that? I would like a 10-course buffet. You're failing me.
I knew there was something missing in this meeting.
Yeah, I was just suggesting that maybe we sort of we only lost 5 people we had 21 on, and we only lost 6 people, so that's pretty good. But
well, I knew Davis was going to have to go, and then of course the
speakers
were going to go.
Yeah,
that would be 4, right? 3 or 4 right there.
Yeah, so maybe if we can shoot for 1 hour and 30 minutes rather than 1 hour and 45 or 2 hours.
Well, I'm open to suggestions about what people want to have in the meeting. We can always change. So whatever you need, let me know. We had not planned for Jane's discussion about COVID, which we've done in the past, but we had not planned on that today.
Well, that's good. I think that we should maybe have an update, but just maybe tighten it up a bit. Maybe shorter updates.
Sure. Okay. I look forward to suggestions on that. And if there are no other comments that need to be made, we will adjourn for the moment. Thank you all for coming. Thank you for participating.
I have just one question of Mary, just a quick update of who our speaker is. Speakers are for next month in October.
We are supposed to have 2 speakers from the Durham County Library, Mr. Leander Coker and Ms. Tanya Wall. Asked them to come and tell us what kind of things will be available at the new library to help seniors who are struggling with virtual technology.
Wonderful. I'm one of those people.
Me too.
We all are learning as we go. Well, I do thank everybody for participating, and I thank you for all your comments. And with that, the meeting is adjourned.
Thank you, everyone.
Uh-huh.